A very good afternoon to all of you. I would be presenting on the impact of soft skill training on patient outcomes in ophthalmology residency programs. So soft skills like communication and empathy are crucial for effective patient care, especially in ophthalmology where quality of life is a key concern. These skills enable the doctors to understand the patient's experiences and tailor treatment accordingly. While generally it is applicable across all specialties, these are particularly important in ophthalmology due to the diverse treatment modalities and the impact of eye disease on the patient's overall well-being. Despite their importance, formal training in these skills is limited in ophthalmology curricula. So the objective was to evaluate the impact of a structured soft skill training program on patient outcomes in ophthalmology residency program. So it involved 48 postgraduate students and they underwent comprehensive training program that covered communication, teamwork, situational awareness, stress management, professionalism and empathy. There was no comparatory group. The primary outcome was change in patient outcomes, satisfaction scores and physician well-being indicators, and the secondary outcome was qualitative feedback from residents. It was carried over a duration of 1 year. So for communication, the content was effective patient communication that included difficult conversations, explaining the diagnosis and procedures, obtaining informed consent, interprofessional communication, the communication with families and caregivers, and written communication. The methods were various like patient encounters, video analysis, case discussions, and workshops, and for the assessment, peer feedback, faculty evaluation, and OSCEs were carried out. For teamwork, again, it was collaborative practice, conflict resolution, leadership skills, and delegation, understanding the team dynamics and working effectively. So it was done by team-based projects, simulations, group discussions, and workshops. For situational analysis, recognizing and responding to critical situations, anticipating problems, adapting to changing circumstances, and prioritizing tasks was used, and how they manage time effectively. For stress management, how they developed the coping mechanisms, the time management strategies, and burnout prevention. The methods and assessment were almost the same in all the modules, so that's why I'm not stretching on that. And again, the two other modules taken up was professionalism and empathy. So on the results on chi-square test, to compare the proportion of surgical complications before and after the intervention, there was a 20% reduction in surgical complication and 15% improvement in patient recovery time. The burnout rate among residents decreased by 30% and job satisfaction scores increased by 20%. So traditional clinical outcome measures like visual acuity, they do not always reflect the patient experience. Patient-reported outcome measures capture how the patients experience their vision and its impact on daily life. So these are increasingly being used in research and practice because they provide a more holistic view of the treatment success. So studies shows that even with improved visual acuity, some patients report poor PROMs, often related to difficulties with near vision. Preoperative discussions about existing limitations and expectations are essential. So for example, if glaucoma, they are often present with substantially initially unnoticed patient, and in medication, non-adherence is a major challenge. So here the soft skills are essential for creating a non-judgmental space, addressing the patient beliefs and providing personalized education, and to identify and address the psychosocial issues. So finally, to conclude, it demonstrates that soft skill training positively impacts both patient care and physician well-being. Improved communication and teamwork contributed to better surgical outcomes and patient experiences. Enhanced stress management reduced the burnout and increased job satisfaction. And integration of these skills into residency programs has the potential to enhance patient care and physician well-being. So its study provides empirical evidence supporting the inclusion of comprehensive soft skills training in medical education, addressing the critical gap in current ophthalmology curricula. These are my references. Thank you.
Very nice initiative and nice study. Just tell me, who imparted these kind of trainings? Did you take the help of a professional peoples in their field?
No, it
For
was
example,
all the
stress management.
Oh, sir, it was the postgraduate teachers only. Like it was the faculties only.
Faculty imparting this particular training.
Yes, sir. Sir, we have not actually included the other departments. Like maybe we can include the psychiatry department as well, but we didn't in this particular study. We have not taken their help.
So how it was done? Did you take some classes on a weekly basis?
Yes, sir. Yes, sir. Basis? Yes, sir. They were given the modules, and they were like by some activities. They were we try to train them like some a situation.
Complex, in so many fields, you have assessed. Although it is very good, but seems to be a little complex.
Yes,
even for a resident or for anyone to undergo all these trainings during their training period.
Yeah.
postgraduate training periods?
Yes, sir. So it
First year,
was
second year, third year.
so it
Fine.
was done over a period of 1 year. So gradually it was introduced. But maybe like sir, better like in the further years, we were just trying to see like whether it is working out or not, because we didn't find out so many studies related
All
to
your
that.
residents participated in the study?
Yes, sir.
Incidentally, I was the chairman of Medical Education Technology Department at my college, Atal Bihari Vajpayee Institute and RML Hospital. And I have an experience of calling and inviting psychologists for imparting soft training to residents, and they were a great help. Apart from research methodology, it's a very good initiative.
Yes, sir. Yes, sir.
Thank you very much.
Thank you, sir.
you.